Well, a very warm welcome to all of you online here. And as you will have noticed, as you were signing in, we are recording, and this is on so that you can play it back and look at it after you leave it, or else just send on the link to other people who may not have been able to join us. My name is Elaine Byrne, and I'm with the HISP program in Oslo, part of the implementation and research group there. And we have a great 90 minutes planned where we'll actually go through the particular apps. We'll look at a short demo, and we'll also go through some country experiences. And thank you all for putting in, when you were registering, your interest areas. It gives us a good idea about your background. I'm not sure we'll be able to address all your queries because it's a wide range of people, from those who are looking at the kind of setting it up and the technical aspects of the applications, as well as those who want to be able to use it. But hopefully we'll spark your interest and your curiosity in learning more about these apps, and we'll post a lot of material and resources that you can follow up on afterwards. I'll just do a brief introduction to each of the presenters. We'll leave questions and discussion till the end, but feel free to post in the chat any questions you have as the presentations are ongoing. The reason we leave it to the end, it's kind of easier for timekeeping, but also we're kind of hoping that as we go through the presentations, some of those queries would actually be addressed. At the end, we'll give the presenters a chance to look at questions that were on the chat if they haven't replied to them, or else summarize the responses. But then we'll also open it up to the floor for further discussion. And as I said, there's plenty of resources that you can look at later on if you want more information, or you can post on our community of practice to get more information. I would like to introduce the first presenter, Maria Muniz, who is a health systems strengthening specialist based in the UNICEF SRO office. Maria will introduce the history of the apps and the use of these data use apps. Thank you, Maria. And as you have done, it's quite nice if you are presenting, if you can, with the bandwidth, open up your presentation, so at least we can see everyone's lovely faces there. Okay, so Maria, over to you.
Thank you so much, Elaine. Just confirming that you can see my screen and that you can hear me okay?
Yes, that's perfect. Thank you very much.
Great. Thank you. So I'm really pleased to be here today and wanted to thank the University of Oslo for organizing this information sharing session. To all the speakers today and to the participants for joining this webinar. I'm really looking forward to hearing from the speakers for what I know will be an informative session, and I encourage participants to feel free to interact and engage throughout using the chat. Feel free to introduce yourself and ask questions, and we will also allow some time towards the end for you to share your observations and reflections during the Q&A portion. So our aim today is to gather as a community of practice, and as Elena said, to share a suite of information use applications that support the synthesis, visualization, and analysis of routine data in DHIS2, which are ready for your use. We'll have a demonstration of some of the features of the applications by the app development team and implementation support teams in HISP Tanzania and Uganda. And our speakers will then take you on a learning journey to Yumbe district in northern Uganda, and in the context of the TB program in Tanzania, to hear experiences from the field in using these applications. We also want to hear from you as a community, how we can improve the current applications and what you'd like to see in the future. So to start us off, I wanted to give a bit of history on these applications. So UNICEF and HISP have been working closely for the last couple of years to develop and support the in-country implementation of the 3 data use applications, Scorecard, Bottleneck Analysis, and the Action Tracker, which we will be learning more about today. And A driving force behind the development of these applications has been to strengthen, from a systems perspective and in an integrated, non-vertical program manner, the synthesis, visualization, and use of health facility and community level routine data for purposes of supporting performance planning and evidence-based performance reviews and decision-making, conversations about data that drive local actions to improve equity and coverage. So a scorecard application is available and that is configurable in national DHIS2 instances, and it supports the visualization and use of data to assess progress on key indicators and to benchmarks of national performance. There's also a bottleneck analysis tool that supports the use of health systems data, so data on supply and demand side factors that affect coverage, to identify health systems constraints, diagnose root causes, and develop local solutions. The visualizations help stakeholders engage in conversations around performance, ask questions, why coverage is low, and facilitate discussions about solutions to address bottlenecks and inform health operational plans. The app also supports documentation of the outcomes of the conversations, as you will see. And then once the solutions are planned, their implementation and effectiveness in addressing system constraints and enhancing coverage can be monitored through an action tracker. And the idea is we often get asked about these apps and how they complement each other. And the idea is that they work together to support different aspects of the information cycle. So the scorecard supporting presentation and communication around data, the bottleneck analysis around root cause analysis and interpretation. And once decisions and actions are taken, the action tracker can support monitoring and implementation of those actions, and to start the whole cycle over again and assess if how performance is or is not improving after those actions have been made, and again to diagnose what are some of the remaining challenges in the system. So there are many exemplary aspects about the app development process for these three applications, including participatory design, rapid prototyping, and user feedback from many of the people that you'll hear from today and perhaps others in the audience. But we know that their success is really going to be contingent on if and how they are used and the difference they make or not in supporting development of evidence-based action plans and improving the lives and well-being of communities and progressing towards universal health coverage. So in addition to demonstrating the app today, we did want to give a chance to hear and share from some early implementation lessons, and it's something that we'll continue to document and learn from in the future. And so before I hand back over to Elaine, I wanted to acknowledge that these applications would not be possible without the hard work of HISP Uganda and Tanzania team developers, the users in the field who contributed requirements and gave feedback, the University of Oslo, the UNICEF staff in the East and Southern Africa region, and to Gavi, who has supported this work through its data strategic focus area. So thank you very much, and over to Elaine.
Thank you very much, Maria, and for putting that into such a comprehensive and very short context. As Maria said, please post your questions within the chat as we go along. And I'm going to hand you over to a presentation on the apps, and I must do what I've asked everyone to do, is to make sure their video is on when they're talking. So I just want to hand you over to two members of the teams that Maria mentioned. So we've got Eric Munyambabazi, who's the lead monitoring, evaluation and learning from HISP Uganda, and Sadiq Mashome, who's the business analyst with HISP Tanzania. And they will do a presentation on the apps in terms of the uses and the implementation. And then we'll also hopefully have a short demo on that. So over to you, Eric and Sadiq.
Thank you, Ellen. It's always nice to meet a wider community that is interested in data use. Just shortly, we will split our presentation into two. We'll make a brief introduction on the applications, and then we'll later on have a bit of a short demo as you have elaborated. I'm sharing my screen. Would you kindly confirm if you can see my screen, please?
Yes, that's great, and we can hear you very well.
Thank you very, very much. First of all, of course, just like Maria said, I would love to thank the team, the University of Oslo team, and the wider community for organizing this webinar. It's good always to share information and get feedback. These applications are some of the best DHIS2 based data use applications, and it's always nice to see that more people are interested in using them. I will make a brief introduction on the applications, and then Sadiq will probably do the short demo. The screenshot you see is a screenshot was taken from an East African community meeting where members were meeting to look at the scorecard, and particularly on heads of state commitment on maternal and child health interventions. And the scorecard appeared as one of those tools that would facilitate providing real-time information to be able to make decisions. So that I thought I would really speak a bit on that background image you're looking at. So I will just highlight a few things on app implementation and use, and then we can probably, like I said, receive some feedback and also questions in the chat room. Yes, I know you can see me, hopefully, but I work with HISP Uganda, and like you said, I lead monitoring and evaluation and support project implementation, mostly on performance as well as quality assurance. As a way of overview of what we are going to be discussing in this presentation, we'll look at a few objectives for the webinar, and why really we thought it's important to share some of the knowledge and also some of the processes that we have gone through to put together the applications. We'll also look at some of the application use cases, both in country and in other places, and also some of the wide knowledge base that we've picked, but also share in terms of resources and community support for these applications. These are broadly thought about objectives for the webinar, and mainly, of course, the other one is most important is to share this knowledge by way of orienting partners on the applications, and to basically discuss and be able to get feedback, explore how the DHIS2 data use applications add value to our national and subnational planning. Maria already, in a way, highlighted how these applications feed one another in terms of planning, in terms of analysis and interpretation, and so on. So we also think that from here, from this webinar, we should be able to develop some, competence in using the applications to do some basic analysis, and also generally pick interest in seeing how they can be able to support data analysis at national and subnational level in our respective places of work as well as countries, but also to look at the implementation requirements, what goes into what is required really to have these applications running, how can we support them, and so on. So broadly, that's how we will be having this discussion, and hopefully that we can get the most of these objectives. So why the webinar? Again, briefly to guide users. Sorry, why the applications? Briefly to guide the users and managers on some of the best practices for data analysis. Again, the applications come together as a way as a way of getting user needs from different environments of work, from different experiences, and then putting them together, but also to see how to improve some of the features that we have within our different applications that we use for analyzing data, especially health data. Then also to enable comparisons in terms of performance at national and subnational level, where we look at different indicators on different programs, on different health interventions, but also to spot areas of strength and weakness to guide prioritization and response. One of the key and very useful applications that we'll be looking at and discussing is the bottleneck analysis. The bottleneck, as the way it actually sounds, we are looking at gaps in implementing different interventions. The app helps us to spot those areas where we have challenges and be able to guide in terms of prioritizing areas of focus in terms of planning and also response, both at national, subnational, and also at facility level, as we will be discussing. Lastly, the apps are really mainly to support tracking of actions. Once we have our priorities set in place and we've put them into a plan, how do we monitor implementation of this plan over time through tracking of these actions? So, and this is where the action tracker is really, really very, very beneficial. So quickly, some few highlights, largely picking out on some of the few processes that the team has gone through and put in place to have the applications work the way they are working. One is already Maria highlighted on the fact that this was user specific and user driven, where different perspectives were picked from different countries. Case in point, Malawi, Tanzania, Kenya, Uganda, Rwanda, and Ethiopia, and to put together really the perspectives on how the scorecard should come together, but also using some of the earlier discussions on, say, for example, ALMA. You probably, some of you heard about the ALMA scorecard. Yeah, so this was really user-driven to put together a traffic light-based kind of analysis that says, if I'm in red, largely, I'm not doing very well. If I'm, my performance in the yellow, I'm progressing, but not maybe so well. If I'm in green, then maybe I can have a smile and then move on. So it was really largely user-driven, but also very simple in a way that we need to use our data. Two, to mention that the application is, again, mainly based within the DHIS2 and also largely dependent on metadata that is inherent within the DHIS2 system. So if in this country you have DHIS2 already implemented at the national level, it is much easier to have the application run within that environment that's already set up, especially with routine data from facilities or even from district. Number three, there are cases from experience where we have found that data resides in different environments. And in some cases, you find human resource data residing in a different system, logistics data residing in a different system. So it's important to, again, bring together some of these different data sources so that you're able to have a comprehensive analysis, especially if you have an intervention that has indicators that are cross-cutting. Number four, important to engage in a consensus building discussion that looks at indicators from various programs so that you are able to identify and define them together, because again, analysis is for everyone, both at national and subnational level. Five, it's also, we also noticed that it's important to set up conventions, for example, for indicators and also for data use, so that it's able to have standard that we are able to have standards that you rely on while looking at this data across, especially where we have data coming from different systems. 6, we also found that grouping of metadata makes analysis very easy, but also makes access to configuration and using the applications very, very easy. Then number 7, which is really not the last, but least, is engage different program teams in terms of review and validating these visualizations to ensure there's quality. So for example, if you have indicators that you have picked from the DHIS2 system and you have used them to customize the scorecard, we found that it's important to verify that the data that you're looking at is what it says it is, and that it can be verified and approved by programs in different aspects. So that's the overall of what the scorecard entails and how it functions in terms of setting up, but also analysis. The second one, again, like I mentioned, I'm giving highlights of these applications. We may not have enough time to look into the details, but the second other implementation approach for the bottleneck analysis is one, we mentioned the user-specific needs to diagnose underperformance in selected health interventions. And this, again, is based on a Tanahashi framework, which we probably will discuss a little bit more later, that looks at performance, performance in different interventions, and then identifies bottlenecks in those interventions based on a framework that considers supply and demand of different health services at different levels. So this again gives us the idea of where to focus and how to focus our interventions. Number 2, just like the scorecard, it also utilizes existing metadata within the national DHIS2 instances. Then also uses the knowledge of stakeholders and experts to estimate, which this number 3 is actually very, very important. For example, where you have cases of data that is not available, say denominators in indicators, important here is to note that stakeholders and experts need to help in terms of putting it together. Then I've already mentioned a bit on the data. Number 4, attention to numerator and denominator and some basic calculations is important, because it's easier to miscalculate and then get a wrong outcome on the chart. Accurate BNA, again, is very contingent on good enough data. The idea is not to have perfect, but data that you can work with that is representative of the interventions that you are implementing at both subnational and national level. Then second last, important to identify data quality issues that need to be corrected. This is really, really important so that you can take care of them through the process of putting together this application. There will definitely be potential data quality issues, but it's important to plan ahead so that you are able to mitigate these quality issues. It's common to find, it's rare to find data that has no data quality issues. I think most important is how you plan to mitigate these data quality problem. Lastly, again, it's the action tracker, like I mentioned. This is around really planning and monitoring actions that go into our plans based on a concept called causality analysis. Causality analysis picks again from the bottleneck chart, where if we have found a bottleneck in our intervention, we're able to say what is causing the bottleneck. And that's where the name causality comes from. We are able to trace and say what caused, let's say, underperformance on human resource and so on. So you're able to cascade the problem and look at, what exactly is causing this problem. So the action tracker deals mostly with this, and we are able to, once we arrive at what the problem is, we're able to document that problem, plan for the problem, and then plan to mitigate the problem, and then monitor our plans. So briefly, that's what really the action tracker is about. Here, number one, identify the real cause of the problem, support the tracking of actions taken to address the causes of these bottlenecks in our interventions, analyze previous periods planning and tracking for the future. This number 3 basically says that if I am going to plan, I need to analyze data. If I am analyzing data, I don't analyze data that I collected in the future, but I analyze data that I collected in the past, let's say last year, and then plan against that data. So our plans are in the future, our analysis is for the past data. Then number 4, plan multiple actions for each suggested solution, is to say that we don't have one solution that fits all. We can plan multiple solutions and then implement them accordingly. Then measure actions taken by looking at performance of key indicators. So in terms of looking at some use cases, overall, we basically consider areas like program performance reviews. Again, the programs, you can use this on any other health program. We can use this to do evidence-based planning, where we have, let's say, quarterly district reviews or quarterly district healthy management meetings. We can use this to do data quality reviews over time. We can also have this to do district performance review meetings, where we are able to document what the outcomes of those meetings, and then plan against those outcomes for monitoring. Then health facility monthly data review meetings, again, to look at different aspects of the data that is generated at the facility. These are some of the few use cases, but again, the apps are generic and can be explored to support any other health or non-health related interventions, as we will be discussing. Lastly, some few pointers on the resources that can be used here. One is there is documentation that is freely accessible online for the user guide, technical guides. These can be found online. The apps have been reviewed and quality assured, and they can be downloaded from the DHIS2 App Store. Some additional information on app releases and also communication generally on support can also be found on the community of practice, again for DHIS2 on that link. The demo and training instance, if you really want to experience and use some of these applications, can also be picked off the demo, the hisp.apps.dhis2.org/training demo instance. And then if you find maybe it doesn't fit your particular environment, and you have a feature that you want to suggest that can be added, we also have Jira for DHIS that we use to again log and then document a lot of the features that go into these applications. I wish to thank you very much for the audience, and hopefully that these applications can contribute to the work that you're already doing, and hope that we can hear a little bit more feedback from you, the team. Thank you very much, and over to you, Elaine.
Thank you very much, Eric, there for your presentation and overview of the apps. We're now going to go into a quick demo And I know we're running a little bit behind schedule, but it's fine in the sense that we're going to have them 2 overviews, so we'll have plenty of time at the end for questions. So Sadiq, as I mentioned, HISP Tanzania, if you'd like to start the demonstration. And I see people have started to post their questions in the chat, which is great. So if you have any questions as the presentations go on, continue in the chat. So Sadiq, over to you with your demonstration.
Yes, thank you very much. I'm Sadiq from HISP Tanzania. So I'll just take you through the apps, the 4 apps that we have, Scorecard, BNA, and Action Tracker, where in particular for the Action Tracker, we have 2 versions, the linked Action Tracker and standalone Action Tracker. So since I'll just be focusing on the demo, I'll just turn off my camera for a while and take you through the apps for a few minutes, and then we'll have the discussion afterwards. So as presented by Maria and Eric, so basically in terms of the apps that we have, the focus is on 3 main components. So we have apps that are focusing on presentation and communication, particularly the scorecard. So what do we want, how do we want to present data, and how do we want to communicate that the data that we are collecting to identify issues and come up to make actions that we want to make. And then we have the analysis and interpretation apps. And lastly, for decision and support, we also have the action tracker, which can be used to track, document actions and track follow-ups that you want to make. So we'll start with the scorecard, which is basically the scorecard and the BNA app are the key parts, the ones that we use to identify issues, do the analysis and interpretation, and then you use the action tracker to document the actions that you have observed from the scorecard or the BNA. So I believe most of you are familiar with DHIS2. If you're not, basically, if you want to access the app, we have the app menu option here, far right. So you can just search and find the app. So we'll start with the scorecard. So we have the latest scorecard is called the interactive scorecard. So some of you might be familiar with the current scorecard version that we have, which is called the normal scorecard, but we have updated the scorecard, and I'll explain why in the next few minutes. So the scorecard that we are going to present is an updated scorecard, which is already available on DHIS2 App Store, and we'll take you through some of the improvements that have been done on this new scorecard version. So basically, that's step number 1. You go to the apps trail and then select the scorecard app for you to access it. And I'll take you through the different features that are there and how you can navigate through the scorecard. Yeah, so the landing page of the scorecard, I'm accessing it as an admin or user with privilege to create some of the scorecards. And of course, the scorecard behaves like a traditional dashboard that you have on DHIS2. So basically, for example, you'll see I have a dashboard already created here called league table RM and CHA, which I can view, edit, or delete. But I have another scorecard here that I can just view, but another scorecard here that I can view, edit, and delete. So that's the first aspect that we have, which is the normal in terms of scorecard development in the past and this new version as well. Once they are scorecard created, you will get a view of those scorecards that have been created, and it will give you options based on how you've been given privilege to access that scorecard. You can either view, edit, or delete if you are given that privilege. But as part of the app, so you have the option here to add a new scorecard. So I'll just quickly click that to show you what we have done in terms of adding a new scorecard. So as Maria and Eric said earlier, in terms of scorecard, we want to give you an idea to quickly present and communicate the data that you have. So what we have done with the new scorecard is make it a bit easier now for user to configure the scorecard. And this is part of the user feedback. It's now step by step where you have the general settings where you can put the name of the scorecard. For example, you say immunization. And then if you have a subtitle, you can put a subtitle for the scorecard. You can put a description. And then you define a period. So basically, as you are defining the scorecard, you can define under what period do you want your data to be analyzed or to be visualized. Is it on a quarterly basis, or on a monthly basis? And these are from the traditional DHIS2 periods. So this is a bit similar to what you can do with the standard scorecard that most of you are familiar now. And then you can put a header if you want for the scorecard that you're creating. And the crucial part now is the translation. So as I said before, the scorecard is used to communicate and interpret data, present data in a very easy manner. So you have some targets that you can define and set for which ones have reached. What colors do you want for a scorecard that for the indicators that have maybe met the target or have not met the target, or they are not on track? So by default, we have green for those that have reached the target. We have yellow for those that are on progress, and then red for those that are not on track. And then if you want additional labels, it gives you that ability to define. So although these are standard labels that we've used, but you can as well use your own labels, or you can as well use your own colors. If you click on the color option here, it gives you the chance to create your own color codes if you have different ways you want to use to translate. So this is part one, where you just provide the basic information about the scorecard, the general, what we have qualified as the general information, and then it allows you to go to the next step. So the next step is the data configuration. As we said, the scorecard now allows you to put together a number of indicators that you want to be visualized. So on the data configuration, another interesting feature is the ability to provide to add indicators in terms of groups. So you can provide different groups and you can define how you want to configure or select the different indicators that you want. So for the sake of the demo, I'll just put some of the indicators. So if I'm adding item here, I can say maybe access to A and C. I add that as an indicator. If I want to add another item, so I have my group here. So if I call it, let's say A and C as a group, then I can add multiple indicators related to that particular group. So if I have another A and C related indicator, I can just add it there. And then I have another option to add another group. So if I want my scorecard to track multiple groups, I can define a second group. Let's say I call it PMTCT. And then I can add items related to that. So all my indicators that I want to track that are related to PMTCT can be added as part of that group. So I can select add item and then add another PMTCT indicator. So basically, this gives you the chance to define such groups. For one scorecard, you can have multiple groups and you can add indicators for each particular group. But another interesting aspect that we have added in the new scorecard is what we define as highlighted indicators. So sometimes you have maybe 10 indicators that you're tracking, but you want your regions or your districts or your facilities to pay attention to a particular indicator when they're viewing the scorecard. Now you have the chance to go in and define highlighted indicators. So this is not a must, but if you have indicators that you think among the 10 that you're visualizing on the scorecard, you want people to pay special attention to, you can easily select and add as a indicator of interest, maybe skill delivery, for example. I'm just picking it randomly. So now as you're viewing your scorecard, this will become an indicator that is visualized in a different manner because you want people to pay attention to that. So that has become step number 3. So you have done your general settings, you have done your data configuration, you have done your highlighted indicators. Then there's an access aspect. So for this particular scorecard, who do you want to have access to? So you can link it to organization unit, specific organization unit. And then if you want some sharing aspect, you can either share it in terms of public, how should people view it, or you can share it with specific people. So if you have certain users that you want them to access, you can easily search and select a specific user that you want to be able to access the scorecard. So that's another aspect that we have added in terms of how you want to add access. So if some of you have used the traditional scorecard, all this was available on a single screen, but what we have done now, we have made it a bit easier in terms of step-by-step definitions of what you can do. And then the last part is the visualization aspect. When the scorecard loads by default, you have the options to define how should it be viewed, what legends, should legends be seen, title, item number, etc., or the average columns. These are things that users can manage later, but you decide as a default. So basically, that's what we have done in terms of the step-by-step configuration of how you can configure the scorecard. But for a scorecard that is already configured, so for example, if I pick this, the RMSH scorecard, it loads with multiple options. So we have the top layer here, which gives you information about the organization units that the scorecard is related to. So for example, this one is for the whole training land at the country level, but you also have the period here for which data visualization is done. And then you have a section here for that particular location. It shows all the districts and the color coded. This is what Eric also highlighted earlier in terms of how you easily view data in the color coded manner or the traffic lights manner, where you can easily see the red as not performing well, or yellow in progress, or green that have already achieved the target. So in terms of how you can visualize the scorecard, so you have, for example, the groups. As I was doing the configuration, I took you through the groups. So you have, for example, here ANC group, Beth group, each with 2 indicators. So as you're configuring the groups, this is how they come to be visualized. So you can have a single scorecard with these multiple groups, and each group you can put as many indicators as you want. Another aspect of interest here is the changes. So you have your increase compared to last period, has it improved or not? So you have some pointers here. If data is visualized over time, you can easily see it could be on progress, but it's going down. So maybe it needs you to have an action to address that concern. So basically, that's it on the scorecard. So the new scorecard has been improved. You have the chance to do the step-by-step configuration, and you have visualization, which is a bit similar to the traditional scorecard, but we have added some few aspects in terms of how the groups are visualized and how you can access it in different manners. And then in terms of download, for those who want to use the scorecard in different versions, maybe you want to print it. So we have also added, we have multiple options here. You can download this Excel, PDF, CSV, or in terms of Alma, you have two options. You can download in terms of JSON or just the metadata that was used to configure the scorecard. So this is the first app as part of the apps that we have done to promote data use for presentation and communication. As you can see, the presentation or communication aspect is covered in the red and green and the yellow colors. We can easily communicate issues or the performance of the indicators. So apart from, in addition to the scorecard, as part of the development that we've done with HISP Uganda, UiO, and UNICEF, we have also developed the BNA. So the BNA is fairly new, and Eric explained it a bit. So accessing the BNA, you go back to the bottleneck to the apps tray option, like how you access any apps in DHIS2, and then here you have the bottleneck analysis app. So if I select the bottleneck analysis app, it loads by default some interventions that have been configured. So as it was mentioned by presenters earlier, Eric and Maria, so the bottleneck analysis is based on the Tanahash model. So basically, it's another useful tool that allows you to visualize data of multiple aspects. So you have indicators related to commodities, human resource, service accessibility, then initial utilization, continuous utilization, and effective coverage. So basically, in one chart or one visualization, you have 6 different components, and you can have data from multiple aspects. So the BNA makes really use of the analysis capability and interpretation, because you can analyze data from multiple components, but you can also easily interpret data in seeing for a particular intervention, what could be the problem? Is it commodity related, human resource, geographic accessibility, and how is it related to utilization? So initial utilization of a particular drug, maybe what about the continuous utilization and effective utilization? So in terms of the app now, as it loads, you get access to the multiple interventions here on top. So if there are a number of bottleneck analysis interventions already configured, you'll have them accessed at the top here. If there are more, you have the option to show more. But if you have access to add intervention, so there's a button here to add a new intervention. So for example, if I say I want to add a new intervention, so what we have done, we have configured also what we call template intervention. So for new users that maybe are not familiar with DHIS2 or bottleneck analysis app, but I want to make use of the interventions that are already configured. So you can select from some of the templates. So ANC services, for example, ARVs, etc. But you can also add your own intervention if you want. So you have the option to either choose from a template and customize it, which makes it easy for you to understand if you're still learning on how to use the app. But if you're familiar with it, you can just select new, and then you are able to create the new intervention. So if you say you want to create a new intervention, it gives you the chance to name the intervention. So I'll say, let me just reduce the size there. Yeah, so as you select it, is it visible? Eric, can you still see it in the team? It's a bit blur on my side here. Okay, so let me go back to the DPT3 immunization, for example. Is it still visible?
Yes, it's still visible. And just to let you know, you've just have about 8 minutes left.
So for example, for the intervention on DPT, so you have the option to manage your settings, similar to the scorecard. If you go to settings, it allows you to change or select different indicators that you want to be part of the scorecard, but you can also manage your color code. So if you want to use different color codes for data interpretation, you have the options to select from there. But close. So in terms of the layout, so the sections that we have on the Bottleneck Analysis app, so we have the first part, which gives you the charts based on the 6 components that we have: the commodities, human resource, accessibility, and utilization. But you also have the Bottleneck sub-level analysis. So for each of the indicators that you have configured, you can have it analyzed at the lower levels. If you want to analyze in terms of district or facilities, similar to the scorecard, it gives you the performance now for those particular indicators that you've configured. So although the first part shows you in terms of the Tanahash layout, this sub-level analysis goes back to a layout that's a bit similar to the scorecard, showing you the actual performance of these different areas. But another part that we have, which is going to be relevant to the next app, is the root cause analysis. So at the bottom here, as you are analyzing this data, it allows you to document what could be the root cause. So for example, for this intervention, we'll say here, maybe I want to add a new root cause analysis. So if I click at the bottom here, new, it gives me a chance to say for that particular intervention, what area have I seen as the root cause? So I'll say maybe commodities. And then what indicator for that particular aspect in terms of commodity is the one that I think is the root cause. So I say maybe availability of DPT, and then what could be the possible root cause? So maybe I'll say delays in delivery, something like that. So that becomes the way that you're documenting your root cause. So you've done your analysis, you've visualized your outputs, but you can immediately document what could be the issue. And at the end here, you have the possible solution. So you can as well document what could be the possible solution. So maybe add more trucks. So you're saying if we add more trucks, that could be a potential solution. So that's what you can do with the Bottleneck app. So you can add configure indicators, visualize it in Tanahash layout, or visualize it in terms of layout that is a bit similar to the scorecard in terms of performance, the color-coded performance, but you can as well document the root cause analysis. So in addition to this, so these 2 apps gives you that chance to easily configure indicators, communicate, and show what is the performance. But now if you want to act on the issues, so you have seen maybe there's a lot of red for a particular indicator or a particular location, that's where now the action tracker apps comes in. So the action tracker apps, we have 2 of them. We have the linked action tracker and we have the standalone action tracker. So for the sake of this time that we have, I'll show you the linked action tracker. So we have here BNA action tracker. This is basically the app that is used for users to document actions related to what they have observed on the BNA app. So for example, in the initial presentation that I've just done, I tried to document the root cause for a particular output that I saw. So on the action tracker now, you can follow that up and continue documenting actions and follow-ups if you want to set budget, responsible person, etc. So that, for example, was for the bad district. So I'll select bad district here. So the intervention was immunization. So we have full immunization there. I'll double click it to select it. No, it was Dina district rather than Bird district. So I'll select Dina district there. And then the intervention was full immunization. So the year, as we are visualizing the data, was 2020. But how the action tracker is set up, it allows you to document actions for the follow-up year. So the logic is very simple. You have done your plan, your BNA intervention setup, tracking, for example, what happened in 2020. So in 2021, now you are documenting actions to address what happened in the previous period. So although the intervention for the BNA was for 2020, as we are doing the action tracking now, acting on what we observed, it's on the following period, just like when you're doing your quarter review. So if you're reviewing quarter one, then your actions will be done on quarter two. So basically, that's how you see this linkage between the period of the BNA and the action tracker. So for here, I'll select 20, period will be yearly, and I'll select 2021. Yeah, so just after selecting 2021, it gives me some of the documentation that was done on BNA. So for example, here, I have the Dina district, full immunization, bottleneck was commodities, indicators was availability of vaccine DPT, and then delivery vans, cooling system, and then budget for van repair. So this documentation was done as part of the root cause analysis on BNA, but on the action tracker now, it allows me to define actions and start acting on it to resolve what I was observed as a bottleneck. So if I say I want to add an action here, so I can now define, so based on that bottleneck, maybe hire new drivers. So this is the action that I want to take. For when do I want to start working on this action? So you define your action date. You can put it the end line, end date if you want. Who is responsible? So you say maybe John is responsible for that, and he's the head of drivers. So he's responsible to act on this action. And then you have your outline on the budget if it requires some budget, so you can define based on the parents that you want. And then if you want to link it to the BNA target. So for example, if you are acting on this action, how much of an impact do you expect it to have on the indicator or on the BNA analysis that you just observed? You can set a target there if you want. And then, so you can save that as an action. So you've taken your bottleneck and now you can track it as an action. So on this part, for the action planning, it allows you to add multiple actions. So if that is the first action that you want to take, you can add another action, as many as you want. And then later, maybe after a month, you want to track what happened. So you have the option here for the action tracking. So on the action tracking now, you'll have your documentation of what was the bottleneck, what was the challenge, what did you define as the action that needs to be done, and then you have for each quarter or each period, you can now document what was the status. So maybe status number one, you can still in progress. So what was the action? So you can say maybe interviews were conducted. So that was follow-up number one. You can just say interview were conducted. And then you want maybe to review this action after 3 weeks to see if it's still in progress or has been closed. So you can say, maybe I want to review it on the 17th and save that. So that now documents an action follow-up based on what you analyze as a bottleneck, what you defined as an action, and what you want to follow up. And this can be done on a quarterly basis. So we have added another level in terms of tracking or visualizing your data. So you don't just visualize data and communicate, but you can as well now define actions and start tracking them. So basically the full set of the apps, BNA, Scorecard, and the action tracker apps allows you that ability to identify, visualize, configure, identify something, and then act on it to make sure you can resolve the matter. And you can as well go back, as Maria said, it becomes a cycle. You can go back to the scorecard to see what is the impact of the actions that you're taking. So the last part is the standalone action tracker, but I think, I'm not sure, Elaine, if we have enough time for that, but the concept is a bit similar, so I can skip the cellular action tracker.
Yeah, unfortunately, we're running out of time, and I'm sure you could take a whole day on this going through all the functionalities. Yeah, but thank you very much for going through that at such a rapid rate. But what we're going to do now is we've kind of had the overview on the history of the apps. We've had Eric present in terms of the uses and the implementation, and Sadiq has run through at a very fast rate each of those applications. So I'm sure you have plenty of questions, so please keep them going through on the chat, and I see people are busy in the chat responding to you as well. So I'd like now to look at some, kind of practical examples from people who have used these apps, and take a few minutes in terms of sharing their experiences. So the first person that we have is Emmanuel Ingaligi, the data analyst at the Ministry of Health, Community Development, Gender, Elderly and Children in Tanzania. And he will look at the scorecard in the TB program. Emmanuel, if you can share, Sadiq, if you could, yeah, so Emmanuel, yes, you're there, we can see your presentation, and I'll hand over to you to go through your experiences.
I'll have challenges to connect, so I'll be presenting on his behalf, but we will listen to him.
Okay, thanks very much. I was wondering there, Sadiq, which you're, okay, that's great. Thanks very much.
Okay, Sadiq, thank you very much for the assistance. As I have been identified, I'm Emmanuel Kirigi from the National TB and HISP program of the Ministry of HISP Tanzania. Sadiq, can you show on the slide show?
Yeah.
Okay. Sadiq.
Yes, can you see that? You're good to go now.
Yes.
That's correct.
Yeah. I have I'm working with the Ministry of Health as the data analyst for the National TB and HISP program. So I support the data collection, analysis, and also prepare reports for the TB and the HISP program. I also coordinated the development of the DHIS2 tracker system, which we named it DHIS2 ETL. Means DHIS2 electronic TB and the lead process system. Okay, Sadiq, let us move to the second slide. Yeah, we started using the score in 2020. Yeah, just 2 years as rolling up the DHIS2 ETL system. The score is made on the test-based data or individuals, and the program we selected 9 indicators, and with selected the indicator which can be generated on any period, and they does not depend on other sources of data outside the system. So, and the scorecard can be generated in all levels, national, regional, and even at health facilities. So to develop to make it scorecard, you see, we made it as one of the tools used by the meeting, and also the region is some of the region they have adapted the tool as one of the staff appraisal on those stuff related to the management of TB and leprosy, and also for the region some of the scorecard is selected to the district medical officers in the case of the TB and leprosy management. For the national level, also we use the scorecard as one of the tools to select the best performance region, which we awarded by giving them certificates. Only the challenge is that the scorecard, you have to select the period, and for some of the TB indicators, you need to relate, for example, for the treatment indicators, you need to select the data for the old period or the previous period as you are assessing the treatment of the patient who have been in treatment for more than 60 or 20 months. So on let's say you can't select the scorecard, for example, if you wanted to know the performance of a certain region or district on Q2. So the treatment indicator needed to select data of the same quarter, but in the previous year. So this is the one of the challenge which of removing the indicator as one of the options. So what we learned is that the use of the forum like the quarterly meeting to present the scorecard output is a tool for the performance, promoted the use of the scorecard, and also the using the tool as the selection for the best performing region, as also for individual performance appraisal. And the scorecard also is used to assess the data quality issue, particularly for the indicator that could be the different when the data are not entered or updated. The scorecard also has made it easy to monitor the implementation at national and the international policies. For example, maybe the TB testing or the initiation of the ART for HIV positive cases. Also, the scorecard output inform the planning for supportive supervision, which you can know at the glance which indicator is faring well in each of the district or the region. So the suggestion is the inclusion of the indicator to track data from different periods in the same scorecard. So thank you very much, and up to the presentation on the scorecard for TB and leprosy.
Thank you very much, Emmanuel. And I think it illustrates there the use of the scorecard at different levels within the health system, also how you were able to adapt it. And I think quite importantly in terms of, facilitating those kind of conversations and comparisons between the different levels and the different facilities. I'm sure you'll have some questions to come, but the last presentation and the person I'd like to introduce is Nsamba Farida, the biostatistician from Yumbe District Local Government in Uganda. So over to you, Farida, for the final presentation. Okay, we can see the presentation. I can't hear you. Okay, you're muted at the moment. Okay, you're unmuted. We can see your presentation.
Thank you very much, Elaine. As introduced, here to present to you the Yumbe District experience for the DHIS2 scorecard Bottleneck Analysis use. As introduced by Elaine, I'm Farida. I work with Yumbe District Local Government in Uganda as a biostatistician with the responsibility to collect, analyze, process, store, and retrieve data on health. The use of the scorecard and bottleneck analysis applications was introduced in 2016 to the district health management team. This was following the new planning guidelines by Ministry of Health that included the use of contextual data in work planning and the use of the scorecard, bottleneck analysis, causal analysis, including management analysis. The expectation was that the guidelines would enable data use at different levels, district and sub-district, and indeed develop evidence-based work plans. Both applications have been used for evidence-based planning in the annual District 1 health plan, program performance monitoring of those different programs as listed. They have also been used in the district performance review meetings and the whole facility monthly data review meetings too. Through identification of the least performing indicators, we conducted bottleneck and causal analysis to identify the possible causes and possible solutions to the bottlenecks. Prioritization, action planning, and implementation tracking followed suit. So before us is a first data use case where we used the scorecard in evidence-based planning, and we see the reproductive, maternal, neonatal, child, adolescent health scorecard for the last financial year. The district health team, as one of the least performing indicators that was identified, was a pre-discharge neonatal mortality rate. And in the conversations the team had by then, the possible causes were lack of resuscitation equipment, 40% of healthcare workers not trained in comprehensive emergency obstetric and newborn care in the last 12 months, limited scope to offer delivery services. Some of the possible solutions and interventions discussed by then: lobby for resources for procurement of resuscitation equipment, conduct trainings for health workers on comprehensive emergency obstetric and newborn care, conduct on-job mentorships, advocate for additional funding to upgrade the health center 2s to health center 3s. Progress made so far, we've had UNICEF support the procurement of resuscitation equipment to the district. Through other implementing partners like JAPIGO, we've been able to train health workers on comprehensive emergency obstetric and newborn care and also conduct on-job mentorships. And the district council has placed a submission to upgrade 7 health center 2s to health center 3s. The second data use case we see is a program performance monitoring, mainly the integrated community case management program. And by then we ran a bottleneck analysis chart for the last financial year. That's the feed that we got, but specifically on the demand determinants, we saw a bottleneck around commodities, and 62% of the villages had took out days of amoxicillin, ORS and zinc, rapid diagnostic tests for malaria, and anti-malarial drugs. Further still, we see in the sub-level analysis, about 62% of the sub-counties still having a stock out. Possible causes: inadequate bi-monthly supplies of ICCM commodities, irrational use of the commodities by some of the village health teams. Possible solutions: standardize the medicine and supplies kits, conduct quarterly support supervisions to the VHTs, conduct a refresher training for ICCM. Progress so far: we have a commitment from the warehouse to standardize the medicine and supplies kit to the whole facilities in the district. And through implementing partners like TASO, the aid support organization in Uganda, we've been supported to conduct quarterly support supervisions to the village health teams. And we have an upcoming refresher training for ICCM for the district health facility and village health teams too. Data use case 3, in the whole facility monthly data review meetings, we see that together for SRH program monitoring scorecard. In the district, we have 4 model facilities implementing the integrated program. And routinely on a monthly basis, we extract and share this data with the facility teams so that they can have conversations on the least performing indicators, but most importantly, possible causes and possible solutions on how to better the indicators. Data use case 4, the district performance review meetings. We have the together for SRH key performance indicators that we shared with stakeholders in the annual sexual reproductive health, HIV, GBV meeting. And at the end of that meeting, we had an action planning session, which had a range of stakeholders ranging from the district health team, whole facility teams, sub-county leaders, and implementing partners. The challenges faced during implementation: the limited number of interventions, both for the scorecards and bottleneck analysis charts. Mainly for the scorecard, what we are able to visualize in DHIS2 as of now are 3 scorecards, 2 speaking to together for SRH program and 1 speaking to the reproductive, maternal, neonatal, child, adolescent health scorecard. Bottleneck analysis up. As of now, we can only visualize 7 interventions, mainly antenatal care for adolescents, deworming in children, institutional deliveries, integrated management of childhood illnesses, postnatal care or postpartum care, routine immunization, and vitamin A supplementation. So with above observation, we had to do some manual development. Mainly what we have in front of us is visual speaking to the elimination of mother to child transmission program. So on the left-hand side, we had to look at the 9 process indicators for the EMTCT program for the district in the last calendar year 2020. And we had to compare what was achieved with the target and also look out for the gap. On the right-hand side, we had to run a bottleneck analysis, mainly speaking to the HIV exposed infants testing. And what we saw on the demand side, we had a bottleneck around physical access. And on the supply side, we saw a bottleneck around physical access. And on the demand side, we saw a bottleneck around HIV exposed HIV infants testing by third PCR. So lessons learned. The use of these applications attracts wider stakeholder participation in planning, implementation, monitoring, and evaluation of health services. We kindly suggest that we have more intervention-based scorecards and bottleneck analysis charts in DHIS2, have the action tracker up in DHIS2, We also need to have the metadata dictionary for the different indicators. Thank you for your kind attention. Over to you, Elaine.
Thank you very much, Farida, for that kind of comprehensive review. And I think looking at evidence-based planning, really a bit like Manuel's case, looking at kind of performance and comparing between facilities and, you know, facilitating those kind of conversations around data. And I think, as you point out, what was really interesting there is that you have that improved engagement with the stakeholders now that you have those apps. And Emmanuel and yourself have also offered some suggestions on improvements, which is great. I see now we're open now to kind of questions. I see there's been a number going on in the chat that have already been addressed. So in terms of from the start, looking at online and offline applications, there's been suggestions on, you know, what can be used offline as well. There's been some very positive comments there to all of your presenters, particularly to the development and implementation teams. I think there's some suggestions in terms of improvements as well, in terms of maybe the kind of periods. If you say kind of period for action, it might make it a bit more clear that it's the kind of future period. And I think one of the questions that is left is whether it's possible to have actions formulated against risks before they become issues within the bottleneck analysis. But otherwise, I think most of those questions have been addressed. So I don't know if anyone wants to answer that question in terms of, you know, possibly identifying those risks before they become issues on a way around this. But I also would like offer, you know, okay, so Dick, if you want to address that question, and then I offer people, if you want to just either put your questions in the chat or just raise your hand. But I'll hand over to Sadiq just there.
Yes, thanks, Elaine. So I think that was a question from Ochunu Ochoge, right? About documentation of actions against risks before they become bottleneck.
Yeah, yeah.
That is possible. As I said, I was doing the presentation. So we have two action tracker apps. So we have the linked action tracker. So the linked action tracker is the one that is actually linked to BNA. So that requires you to first identify the bottleneck, then start tracking actions. But you also have a more flexible standalone action tracker, which does not necessarily limit you to the BNA. It's more free for you to identify issues on your own way and then start tracking actions and follow-ups. So for that, I would say, please check out the standalone action tracker app because it's free. It's not linked to BNA. So you can devise your own ways to say, this is how I identify issues and these are the actions. So that is more open-ended. So I would say possible, but please use the standalone action tracker rather than the BNA linked action tracker.
Okay, thanks very much. And Jimmy Ogwal, if you've raised your hand there, do you want to, is it a comment or a question that you have? Or are you going to share your experiences?
Yeah, thank you very much. I would just like to add briefly what my colleague from Uganda has said.
Right, yeah.
The truth is that using the bottleneck and scorecard, we have taken over, not as the Ministry of Health thing, we have now been training the local government leaders to use bottleneck analysis as an evidence-based planning tool. It's a managerial tool. And the Scorecard has been helping us so much to monitor this progress in some of the implemented indicators. Now, the challenge, we have some few challenge. You know, we do what we call bottom-up approach planning. And we start right from the lower unit, like this parish level, health facility level. But one of the challenges which we have been having with the bottleneck analysis is the denominator, which we should use for some of the indicators. It's very hard to determine facility-based denominator, which has been hard to allow us to populate facility-based bottleneck. Now, also, we have the data limitation in the 6 determinants of the bottlenecks. We have effective coverage, we have adequate coverage. All these 6 determinants, some of them we may not have routine data to populate them. Some data requirement may need the surveys. So that's where I think we still have the limitation, which we need to or improve on our routine data collection, which is still also big. And so in line with that, it's mostly on quantitative data. We don't have the qualitative aspect of it. For example, when we talk of access within 5 kilometer radius, that's geographical accessibility. But there's some other accessibility which may be qualitative, which also we should, we are limited to use in our bottleneck analysis. You see, the bottlenecks look at the 2 building blocks. We remember we have the 6 building blocks in our health service, our healthcare service delivery. So it has left out building block like leadership, health information, and financing. It's not captured into the bottleneck. Yet they contribute heavily on our healthcare service delivery. So these are a bit of limitation which we still have to build within the bottlenecks. Otherwise, it has supported the countries immensely through evidence, planning, and budgeting. Thank you very much.
Okay. Thanks very much, Jimmy. And as you say, I mean, a lot of these issues are, I mean, as Maria pointed out in the very beginning, they're kind of tools to assist in the information cycle. But there will still be challenges within, as you said, the routine health information system around kind of denominators. And the app is not going to overcome those. You still will have to address those issues in terms of the routine health system. And additionally, as you say, I mean, it just focuses largely on the quantitative indicators, but we would assume that, you know, other assessments would be going on within your health system. And then that information could also help you in terms of your kind of action tracker. I'm not sure if anyone else has raised a hand or would like to contribute. I can hand back over to the presenters if they would like to have a final word or if they would like to expand on any of the responses that they've given within the chat. So I'm not sure if Maria, you would like to say anything, Eric, Sadiq, or if we rushed you a bit in terms of Emmanuel and Farida, if there's any points you feel that you would like to still add, just raise your hands. Okay, Eric.
Thank you, Elaine, and thank you, team, for the great feedback and for really being very attentive and contributing to the discussion. I think personally, my experience with the apps is that they are really very, very good and great applications. There are some few inherent challenges in terms of data availability, but those challenges are really on case-by-case basis, and they can be solved. And the applications have really proved to be very, very good. And for participants interested, please feel free to reach out to any one of us so that we work together to really improve our data use experiences in our own countries. There was a question earlier on sharing the presentations. I think Elaine, we may have to add a bit on that, on how the participants can get access to the material shared today. Over.
So what we'll do is we will share the recording of this session so that within that you'll be able to play back and look at the presentations. So this, as we said, it's been recorded and you'll be able to look at it on the YouTube link that we'll send out to you. So a few more closing remarks by Sadiq and then Maria.
Yeah, so maybe I'll just echo what Eric said. So thank you everyone for taking your time to attend. I know this was a bit brief, but we managed to cover what we could cover, and we appreciate your feedback. Maybe just last comment based on from the presentation that was done by Mr. Nkirigi. So he mentioned that the TB use case, they have used individual level data. So it's very important to also let the participants know that traditionally we are creating scorecards from aggregate data. Yeah. But we have a use case in Tanzania that you can actually start tracking individual level clients using the tracker module of DHIS2, and then have a way to create a special scorecard for that, which is not used in a very common manner. So I think those are the things that the apps are evolving in the field, and it's good for the teams out there to know that you're not limited to aggregate data, but you can as well have scorecard as when you start from collecting individual level data, like what the TB team in Tanzania has done.
Okay, thanks, Sadiq. I mean, I think that's quite important, kind of illustrating the flexibility in terms of the levels, but also you're saying from aggregate to individual data. And Maria?
Thank you, Elaine. I just wanted to really thank everyone for their contributions to this webinar, and to highlight also some of the implementation challenges, as was highlighted that even though the applications have evolved, they have been designed with user input. As you can see, we have great inputs from users today, so we're continuously looking at how to improve and add the functionality to respond to users. Also, that the apps have really provided a space, as you've seen, for conversations about data, highlighting data quality issues, data quality gaps. As Jimmy highlighted, to do a full comprehensive BNA, you do need to take into account the enabling environment, to have a facilitated discussion that brings in different perspectives. There's some aspects of access, financial, other barriers that may not be captured with the routine data in the system. So it's about bringing all these pieces together. But one thing why we thought that these apps could make a difference is for them to automate some of the analysis and also the ability to drill down. So you saw some examples of facility level use and being able to look at not just the picture at district level, but what's happening at facility. And so by automating some of the analyses and highlighting those data quality issues and gaps, part of the idea is to allow for more time for conversations about data, for the action planning, that deep root cause analysis. And we saw some of examples of that in Yumbe district. So I hope that we've highlighted a bit how the apps can help with bringing forth these conversations about data, that in order to continuously improve and go through that information cycle will need to be addressed for these apps to be effectively used. And looking forward to continuing this conversation. I know there are other countries that represented here on the call, just to say that also, as Eric has highlighted, there's documentation. We've been working with the University of Oslo team to embed some of this learning into the academy's curriculum, and also to put some videos. So we also look forward to hearing from others what we can do to support you as a community and using and learning from these apps. Thank you so much.
Thanks very much, Maria. And just to reiterate, to thank all the presenters today, but also the teams behind them that they represent. So hopefully you'll pass on those congratulations and the positive comments that we've had here, as well as, them sharing kind of challenges. So thank you all for participating, and hopefully we've whet your appetite to go and look at those resources. But also we'd encourage people who are actually using these apps to also share their experiences, both, in terms of how they've adapted it and, some of the challenges and maybe the ways in which you've innovated and overcome them. So we welcome any of those stories through the community of practice or through direct email to people that you know in the team. Thanks to all of the people behind the scene. There's always people behind working on the technology, preparing to make everything goes very well. So thank you all to those behind the scenes for organizing and making sure this webinar ran very smoothly. So we've just finished there, and hopefully the conversation will continue. And as Maria said, these applications are continuously evolving, so we're listening to the stories. So we'll take into account the requests, the suggestions, and the experience shared to continuously improve these apps. So thank you all very much, and hopefully you have enjoyed the last 90 minutes. Bye.